Hello, hello. Hi, everybody, and welcome to the day of today, which is September 14th, and we are in the peak of the application cycle before applications get released on September 29th. And today we're going to be diving in to the nitty-gritty of the details for residency personal statements. So I'm going to be joined by Tiffany, who is the Director of Communications as well as an editor and writer for Residency Statements, and we're going to be detailing some of the things you should be considering when you're finalizing or starting your personal statement. So I have a question for everybody out there right now, which is, have you actually started your personal statement or not? And if so, congratulations, kudos to you. And if not, it's going to be very important to keep in mind that you need to start that as soon as possible. Many people spend months drafting their personal statements. And if you are crunched on time, we're going to go over some of the specifics in just the next 2 weeks. So again, I'm going to be joined by Tiffany, who is the Director of Communications and a editor for Residency Statements, as well as writer. So welcome, Tiffany.
Hello, everybody. Thanks for joining us today. How's it going, Zeph?
Pretty well. We are in the peak of the excitement, and yeah, I'm ready to dive into some more of the details for personal statements. So can you just give us a quick little introduction of yourself, Tiffany?
Sure. So as Zeph mentioned, I am the Director of Communications for Mancha Resident, but I do have a secondary role with Residency Statement where I am a writer and an editor of Residency Personal Statements. And I've been doing that actually for a little over 6 years now. So I've done my fair share of editing and writing statements from all different specialties, really, all 18 of the specialties that we offer at Mancha Resident, the AMG friendly specialties. So I think that I have a wealth of knowledge to share with our viewers today about the most frequently asked questions when it comes to personal statements, and I will offer any tips and advice that I can for the questions that you guys post.
Perfect. Yeah, so be sure to leave your questions in the comments, the chat, and we'll be sure to address as many of them as possible. I'm also the editor-in-chief for the Residency Statements branch of our services, as well as Residency Experts, which is actually where we provide editing and optimization for both the MyAris application, supplemental application, and personal statements. So we both are going to be able to share some tips and insights into the personal statement process and expectations, because one thing that I just want to start out by saying is that the personal statement is very important, but the most important aspect of it is that you don't get noticed for the wrong reasons. And there's so many ways you can stick out poorly for the personal statement. So hopefully we can address ways to stick out productively and professionally. So can you give us a little bit of an introduction, Tiffany? How long should the personal statement be?
Sure. So that is actually one of the most common questions. How long should it be? And the answer really is about a page. There is no concrete, it has to be exactly this long, but you do want to aim for 1 page. Something that a lot of people don't realize is that 1 page in a Microsoft Word document is different than 1 page in the ARIS application system. So, excuse me, okay. In the ARIS system, you won't actually be uploading a PDF or a document. You're actually going to be taking the text and putting it directly into ARIS, much like your CV. If you don't upload a PDF of your CV, you're actually taking your text and putting it into text boxes. So 1 page comes about 750 words. That's really the sweet spot. If you have much more than 750, then you might be bleeding on over into the 2nd page. And of course, that doesn't mean that you're not going to get read or that they're immediately going to throw away your entire application because you've got a little over a page. So it's good to stay at 750 words, but if you have something important to say and you need to bleed over into the 2nd page a little bit, that's okay. Program directors are reading these personal statements because they really do want to get to know you a little bit better, and they want to learn about you outside of your CV. So the length is going to come down to your personal preference, but you should try to stick to 750.
Perfect. Yeah. And so a range that we typically use is about 600 to 800 is like the kind of minimum and maximum, although there is some leniency in both directions. It's important to really shoot for that 700 to 750 word length because it really should be fairly short, sweet, and concise at the end of the day. You know, some people will start drafting their statement and it's pages long, and that's not the way to go. Nobody's going to read that. That's too much information. So when you're actually writing the statements, you know, does it need to have a consistent theme, or, you know, can you tell us a little bit more about that?
Sure. I apologize. I keep readjusting my my phone seems to be moving as I'm talking.
It's getting away from you.
Okay. I'm actually going to hit one more time. Okay. Hopefully it'll stay. So as far as theme goes, this is another really common question. Should your personal statement have a theme? And the answer is yes, it should. And the theme is you. The personal statement should be very focused on you. Every paragraph should be really narrowing in on your strengths and your experiences, and very importantly, how they connect to the specialty that you're applying for. So should you have a theme? Yes, and the theme should be you. Should you have a more story type of approach or a narrative-based personal statement with like the theme of courage or overcoming obstacles? In my opinion, as a professional writer and someone who's written so many different statements, no, you should not be using a narrative type theme that in every paragraph you're touching on courage. That typically doesn't work well. It feels forced. So you can't necessarily pull one theme through all of your experiences and all of your strengths in your background. So it really doesn't work well to try to do that.
Mm-hmm. So what's a good way to make the personal statement engaging? You know, when you're trying to start the first paragraph, how do you capture the reader's attention?
So it does make sense in your first paragraph to include some story-like elements. Maybe you're going to open up with a story about a patient, a very engaging patient, or maybe even it's a dramatic patient story where something happened that is going to immediately get your reader's attention. However, you don't want to do that for the entire opening paragraph. Your readers are interested in reading about you. And if you make your opening paragraph exclusively about this dramatic story with all of this dialogue and you're using lots of adjectives and, you know, more the creative writing style, they're going to wonder, okay, this is interesting and you've got my attention, but when am I going to learn something about the person who wrote this particular statement? So the first couple of sentences, maybe the first 2 to 3 sentences, if you want to dive in with a story-like approach, you can do that, but then you need to transition back into how this story is relevant to you as a match applicant. So that's one approach, is to use those first few sentences to include a dramatic story, again, about a patient. It could be something that happened to you. It could be something that happened to a family member. But that's not the entire paragraph. It's just a couple of sentences to get the program director's attention.
Yeah, and so something that I feel like we see a lot is people will use the entire first paragraph and it's not even about them at all. It's about, you know, this external story or maybe something that happened to them as a child, and it's full of drama and, you know, very expressive language. But you just used about 20 to 25% of the statements to say nothing about yourself as a medical residency applicant. So it's very important to keep that to a contained minimum in terms of the actual content and space you're using to, you know, grab the attention, which is very appropriate. But just make sure that when a reader finishes the first paragraph, they already have a sense of you as the applicant rather than something completely unrelated.
One thing that I'll add on to what you're saying is that when you're adding in these elements to get the reader's attention, you want to do it with intention. So every sentence and really even every word, every phrase within your personal statement should have a purpose. And if your intention is to get the reader's attention, then you can do that very quickly And then since your intention should be, as Seth said, that by the time they reach the end of the first paragraph, they know something about you, that is going to help you create that first paragraph in a way that begins with an attention getter, but then very quickly transitions back to you. And another important aspect of the introduction is that it tells your reader what specialty you're applying to. Now, they already know what specialty you're applying to because they've seen your application. You're applying to their particular program for, say, pediatrics. But it needs to be clear in that first paragraph that you are applying to that, and that the rest of your statement is going to talk about your interest in that particular specialty.
Yeah, and so that's another big mistake that we see is people don't even introduce the specialty sometimes until the third paragraph. And at that point, you've already lost the reader. You know, they want to know why you're interested in internal medicine or anesthesiology. And if they don't get a clear sense of that within the first paragraph, they're basically going to skim until they see, okay, why are they actually applying to our program in this specialty? So again, for the introduction, make sure that your engaging hook is not the entire first paragraph, and start introducing yourself as the applicant and your pursuit of medicine and the specific specialty early on in the statement before getting to the body. And so what should really be included in the body paragraphs for a personal statement?
Before we move on to that, which I will jump into the body paragraphs in just a second, just to speak more just in a particular specialty right at the beginning. Another reason this is important is because we want specialty specific statements, and we talk about that a lot. Some of you will be applying to different residencies, maybe internal medicine, family medicine, and pediatrics. And you need to have a statement that is specific to each of those specialties. If your statement does not mention the specialty in each paragraph, then it becomes very clear that you've got more of a generic looking personal statement, and it kind of clues program directors in to the fact that, hey, this person doesn't care that much about this specialty. They probably submitted this same document to several other specialties as well. So that's why we always, recommend very specialty specific personal statements, and making them specialty specific means you're talking about the specialty in every single paragraph.
Right, and that's, yeah, exactly, something we see a lot when people are submitting a statement for editing through residency statements or residency experts. They will ask if we can write it or edit it to be generic for multiple specialties. And the truth is, we say no, that will not help you. If you present a personal statement for family medicine and the exact same statements for internal medicine, even though it's a primary care specialty to some degree, that's not enough. It's not going to cut it. So like Tiffany said, make sure the specialty is reinforced from beginning to end.
Absolutely. So now we can jump into those body paragraphs. And one thing that's important to talk about when it comes to the body paragraphs as related to the introduction and the statement overall is that there is not a specific number of paragraphs that you have to have. Many people think that they should stick to the 5-paragraph themed essay, and that is something that anyone who has gone through undergraduate school, and all of you have, you probably did a lot of writing 5-paragraph themed essays where your introduction includes a thesis statement with 3 key points, and then you expand on those 3 key points in your 3 body paragraphs before concluding. And that's an important part of learning how to write well, but we have moved beyond that once we are done with writing research papers for undergrad. So the personal statement should definitely not follow that pattern. It's really kind of elementary, and it really limits what you can do within the personal statement. So number 1, no thesis statement is required. Number 2, you are not limited to 3 body paragraphs. It's okay if you have 3 body paragraphs, but if you have 2, that's okay. If you have 4, that's okay. So that speaks also to the length of these paragraphs. It's okay, and you actually should have paragraphs of varied length. Some people mistakenly think that you should have paragraphs that are very uniform in length, and that's just not the case. This is a writer's tip that I'll throw in. writing is often more than what the words actually say. It's how it looks on the page. And from a reader's perspective, when they see a document that is all uniform, big, long paragraphs, so 10, 12 lines in a paragraph, it doesn't look appealing to them. It looks a little bit intimidating, and it actually has an implied tone of being boring because it's too standard. So you actually want to work toward having paragraphs of differing lengths. So maybe opening paragraph is 8 lines long, and then the next paragraph is just 6, and then the following is 10. So having some visual, I guess, variety on the page is actually a really good thing within those body paragraphs. So as far as the content for your body paragraphs, you want to first and foremost remember, again, the theme is you. So it is great to include things like, number one, a patient story, something that's very interesting and is, again, going to grab your reader's attention. However, just like with the introduction, if you're going to share a patient story, make sure that you actually played a role in the care of that patient. I do see a lot of statements come through for editing where there's this absolutely fantastic story of a really challenging patient with an insane diagnosis and they made a miraculous recovery. And then at the end of the paragraph, it's like, observing this case really taught me a lot. And it's like, that's really not going to work. Observing a case is not the same thing as talking about your strengths and your experiences and how you can use those within your residency to help make the program a better program.
Yeah,
so number one.
Yeah, there's something I want to add to that too, which is the clinical encounters examples is another space where people will spend almost an entire paragraph giving the background of a clinical example. And that is just a waste of space. You know, you can give the bare bones of the situation, you know, the presentations, the diagnosis, the outcome. But if you spend an entire paragraph talking about all the background for one clinical case, that's not proving anything about yourself. So the focus, again, should really come back to what was your involvement? What did you learn about this specialty or yourself through that experience? And don't dedicate too much time to giving so many details about the background of that clinical example.
Yeah, and I think that sometimes when applicants are writing these statements, you forget who your audience is. And these program directors have decades of experience in the medical field. They have seen impressive and interesting cases themselves. They're not reading your personal statement so that they can be entertained by a really interesting patient case. So like Zach said, you can really keep those details to a minimum, maybe 2 to 3 sentences. Sorry about that. So 2 to 3 sentences is enough to convey the details of the case. You know, the patient's age, their gender, what they were admitted for, what the symptoms were, and the outcome. That's it. That's all we really need. And then you should transition into your role in the case, which should be hands-on. If you don't have a patient case that is interesting and that you played a hands-on role in, you don't have to include a patient story. That's something that you can include, but it's not something that is absolutely required for your personal statement. So if you don't have one, that's okay. Just skip that element.
Exactly. And that's actually something, I saw a question pop up earlier about how to avoid cliches. And, you know, if you're a program director, how many patient examples or patient encounters have you read? And it's probably hundreds, if not thousands. And so the question you need to ask yourself is this helping inform the reviewer something about me specifically? And so patient encounters, like Tiffany said, they are not necessary. You know, if we have 400 out of 600 statements that have patient encounters and 200 of those have very strong statements without them, those 200 might have more space to be talking about themselves, their journey, their process, their outcomes, versus, you know, sticking a long-winded patient encounter in there. So again, if you do decide to include it, make sure that it is relevant to you and really try to add something that is memorable about the case. You know, if you were to read hundreds of patient encounters, what would actually be memorable about you within that experience?
Yes, that's great advice. And that speaks to the purpose of the personal statement, which is to create a lasting memory of you as an applicant in the program director's mind. So you don't want them to remember that interesting patient case. You want them to remember you as the applicant. So that's something else to keep in mind. So continuing to talk about the body paragraphs, you can include a patient case or a patient story if you have one that you were very active in. You can also think about having a paragraph that outlines your specific strengths and characteristics. So that actually comes across as a little bit cliche, just saying it in that way, but it's not. That's really the focus of the personal statement, is how are you as an individual bringing specific strengths and your personal traits into the program in a way that's going to help build up the program. So you have to talk about your strengths, your experiences, and your traits. And you can do that, of course, a little bit within every single paragraph, but there should be a dedicated space where you're talking about yourself in a confident way and explaining what your strengths and characteristics are. Of course, you don't just want to have a list of strengths. So you don't want to say, I'm really strong at multitasking, I'm an analytical thinker and a creative problem solver. Also, I'm good at communicating and formulating differential diagnoses. So that's great. You can list all of these things, but so can the next person and the next person and the next person. So the key is to choose somewhere between 2 and 4 strengths or characteristics that you know that you possess, and include examples of those strengths and characteristics. So, and in terms of length, you're talking about maybe 2 to 3 sentences per characteristic or strength. So if you want to talk about your versatile communication skills, you can then give an example of, perhaps, again, let's use pediatrics as an example, how you have experience talking with both toddlers as well as teens, and then you could maybe do 1 or 2 sentences about a patient that you encountered within that age range to demonstrate your communication skills. So again, it's making the
and something else to keep in mind. Oh, sorry.
An example. Oh no, that's okay. You froze a little bit. I didn't realize you were talking.
Yeah, so just another point on that is, it doesn't always have to be a clinical example. And this is another question I saw pop up, like, is it okay to include your CV experiences in the personal statements? And something to keep in mind is that the personal statement should not be a direct copy of your CV experiences, but it is very appropriate to incorporate some of those experiences as examples for the characteristics and traits and qualities that you're talking about within the personal statement. So if you had an experience where you were working with a certain population, and that's in your CV, but in the personal statement, you can talk about the experience in a more holistic and a more reflective way. That's very appropriate. And it's a way to show your characteristics versus just listing them. So we always like to say, show, don't tell. And like Tiffany said, you can list qualities, but the most important part is that you demonstrate them through concrete examples, as well as wrapping them within a reflection about how you learned from that experience and how it helps continue to reinforce your path down the specific specialty that you're pursuing.
Yeah, absolutely. And that's a really good point in terms of considering your CV in connection with your personal statement. So while they are completely separate from one another, they're intertwined, and you have to think about how you're going to use those written sections within the ARIS CV, and then how you're going to use your personal statement. So you do have this really great wealth of opportunity to talk about your clinical experiences in both places. The key is that you don't want to be repetitive. So think about what you want to highlight in the CV and that character count that you have. I think it's 1,250 versus what you're going to elaborate on more in your personal statement.
Exactly. Yeah. So it's 1020 for the ARIS application experiences. And exactly, the content should help, they should integrate one another. So the experiences found in your CV should be integrated to some degree with the reflections found in your personal statement, which should be integrated with the shining reviews you get in your letters of recommendation. So all three of those things should balance one another while not repeating the same information.
Absolutely. And that's tricky, right? So that's one reason that if you are maybe procrastinating a little bit on getting started with your personal statement, leaving it till the end,
Yeah.
no one would do that. You should get started today. Like as soon as you possibly can, you should get started if you have not gotten started yet. I'll throw in another writer's tip right now. Getting started does not have to be hard. You can start with a list of bullet points of all of the topics that you think that you want to talk about within your personal statement. And from your list of bullet points, you start building some sentences and then some paragraphs. So I think a lot of people procrastinate when it comes to writing because they feel that they have to sit down and write something that's really great as soon as they start writing. And you don't have to do that. You can start with something really messy. I like to say, start with what's easy. Whatever you're thinking about, just start writing that part. Don't force yourself to write the introduction right away. It's very difficult to introduce a document that does not yet exist. It's actually much easier to write an introduction after you've written the rest of the statement. So just keep that in mind. If you haven't started yet and you're intimidated by the idea of starting, just start where it's easy, make a quick list and start building sentences and paragraphs, and it will come together more easily for you if you take a more chaotic approach, believe it or not. An organized and structured approach doesn't usually work well for writing.
Yeah. And on that note, for people who do feel they need a more organized approach, one suggestion is to create an outline. Tiffany mentioned using bullet points, and it's totally okay to just list what you want to talk about and then start writing, maybe like Tiffany said, with a body paragraph, with something that you're familiar with or comfortable with. And you'll be able to then connect those ideas together as you're writing the statement. But having a trajectory in mind can be helpful for keeping it organized. And if you're really struggling, and let's say English is not even your first language, and you do not feel equipped to write a statement, there are writing services available. Definitely recommend visiting residencystatement.com. Like Tiffany said, she has been a writer and editor with Residency Statement for multiple years. I'm the editor-in-chief for that service, as well as chief advisor for Match Residents and Residency Experts, where Residency Experts is helpful if you have already written your personal statement and you'd like your ARIS application plus your personal statement edited and just polished to make sure everything is perfected and refined. But there definitely are options available. And the biggest thing, like Tiffany said, if you're writing from scratch and you're starting it, you need to start now. If you're looking for professional help, get it going because it's crunch time now. We only have about 14 days until it's going to be past the 29th. So definitely keep those things in mind. And I think it'd be good to maybe address some of the ways to end the personal statements. How do we conclude? Do we summarize everything that we've already talked about? Or what's a good ending for a personal statement?
Sure, that's another really good question. And the answer is kind of in line with the idea, first and foremost, that this is not a 5-paragraph themed essay. So most of what we've learned in school about writing tells us that your conclusion should summarize your document. And that's just not the case with something this short. So the purpose of summarizing in a conclusion is to remind your readers about what they read. In this case, they're not going to have forgotten the 600 or so words that they just read. So you don't have to be repetitive in your conclusion. I should say you should not be repetitive in your conclusion. You don't have the word count to repeat ideas in this document at any point, but especially not in the conclusion. So what's really important in your conclusion, because usually the last thing that a reader reads is what's going to stick in their head, is that you highlight things that you want them to know about you. And that's going to include what you're going to be and what you're going to do as a resident. So if you want to start community outreach initiatives, if you want to lead different types of groups within your residency cohort, you should talk about those things in your concluding paragraph. And all of the ideas that you have and the passion that you have for your residency should really come together and come to fruition in that concluding paragraph. A lot of applicants also like to talk about what they want out of a residency, and the ending paragraph is a really good place to do that too. Word of advice or caution is don't use cliche things. Like, what you want out of a residency is to improve your clinical skills. You and every other resident applying, right? Don't state the obvious in your conclusion. Come up with things that are going to help you stand out as a unique applicant, and don't just bury yourself in with the hundreds, if not thousands, of other residency applicants to that program.
Yeah, so I just want to quickly summarize basically the 4 most important things that every residency personal statement should include. And this also highlights a good outline for the possible structure of your statement. So number 1 is your introduction and interest in medicine, as well as your specific interest in the specialty that you're applying to. So why did you first become interested in the specialty? The next would be concrete examples of your characteristics, strengths, and qualities that make you a good fit for that specialty. So again, this is going to be more of like your body paragraphs. What are the concrete examples? If you're going to include a clinical encounter, if you're going to discuss some of the experiences that you've had as a physician, maybe in another country, if you've been a physician, talking about really critical things that exemplify your skills while also wrapping them with reflections and growth. Very important. And the next would be expectations for residency training programs. And again, like Tiffany said, make sure that they're not going to sound exactly like every other resident out there. What are you truly looking for? And that also helps potentially match you with the programs you're more interested in. So you don't want to necessarily be generic, because you want to match to a program you're truly going to enjoy and fit into. And the 4th would be your future vision and goals. What's your 5-year goal? What's your 15-year vision? Where do you see yourself? And what do you hope to contribute to medicine? I mean, that's a great way to end a personal statement, is with your vision for your contributions to medicine and to society. And that also tends to leave things on a very uplifting note, and it's a strong conclusion, while also, again, not just summarizing what you've said previously. So again, interest in the specialty, characteristics and experiences that make you qualified, expectations of residency training, and then future goals and vision. And if your statement includes those things, you're going to be in great shape. So is there anything that you think I missed in there, Tiffany, that would also be very essential for every residency personal statement?
Well, I think that there is one more thing that I see very frequently in statements that we could talk about really quickly. People wonder, should I talk about why I got into medicine? So obviously you're going to talk about why you chose the specialty that you're applying to, but what about why you chose to pursue a career in medicine in the first place? And you can talk about that, especially if there is a very engaging and highly personal reason that you decided to become a physician. You should not spend an entire paragraph talking about it. So again, that's something that could be included in your introduction, a couple of sentences, and then you would be transitioning into why you chose the particular specialty. So just to put that out there, it is okay to talk about why you chose medicine. That's usually the focus of your personal statement, is why do you want to be a physician? But it takes on a little bit of a different tone. Like, now most of you have graduated from medical school, or you're about to graduate from medical school. So it's not why I want to become a physician, it's why I became a physician. And it is okay to talk about that in the personal statement. Mm-hmm. And one more thing I want to add in has to do with tone. So I do get a lot of questions about not wanting my personal statement to come across like I'm being too aggressive or I'm bragging about myself. And that's true. You don't want to come across as though you have a huge ego and you just want to brag, brag, brag. But you do want to be assertive and confident. So there's a difference between being aggressively egotistical and being assertively confident. And confident is important. You should absolutely speak with confidence about your skill set and about what you want to do with your business. kind of pitter-pattering around saying, I believe that I might be this, or I believe that one day I could possibly be this. Those things sound wishy-washy and unconfident. So use words and phrases that exude confidence, because that's what program directors want, is confident residents coming into the program.
Mm-hmm. And something to add to that is a lot of times people come into writing their personal statements trying to address all their insecurities. And, we're going to dive into, addressing red flags for probably the last half of this conversation, because I'm sure a lot of people have questions about what red flags to address, where to address them, how to do it. But basically something that's important to keep in mind is you should not be talking about all your insecurities and why you might not be the best applicant, but you're such a hard worker and you can overcome, any obstacles. Being a hard worker and overcoming obstacles is great. Focus on those. Don't focus on the reasons why you don't feel like you're the best applicant for so many reasons. And, that being said, we are going to be diving into some more details about red flags and when to address them and how to address them. Is there anything else that you want to chat about before we dive into some of the red flags and that sort of issue that many people have to be concerned about addressing?
No, I think we can go ahead and start with the red flags. That sounds good to you.
Perfect. Yeah, so in summary, what are some of the red flags that you feel like should be addressed in the personal statement?
Sure. So there are a few very common ones, and those include having either very low step scores, or having multiple attempts on your step scores, or having an extended gap or leave of absence during your training. So those, I would say, are the top 3 red flags that I have seen in personal statements over the years.
Mm-hmm. And so is that something you should start out with in the first paragraph, or sneak in at the end in the conclusion, or where should that go in the statement?
My preference for addressing a red flag is actually in the second to last paragraph. So definitely it's not something you want to open with, and it's definitely not something you want to close with. So that would dictate that it would be somewhere in the middle. And I think most of the time it's best to save it for not quite last. So you want to start out strong, highlight all of your strengths and your experiences, and you kind of get your reader on your side and really liking what you're saying. And then it's, kind of like, oh, and by the way, I do want to address this one small thing because it's important to me to address and explain to you. And then you're turning back around into a strong, positive conclusion. So near the end is a good placement for addressing red flags most of the time. Writing is not black and white or always the same for each person, but most of the time toward the end is good. I think that when addressing red flags, it is best to do so straightforwardly. It is best to dive right into what the red flag is, a very upfront statement. I was disappointed when I learned that I did not pass my step 1 exam on my first attempt. So don't try to sugarcoat it. Some people prefer to try to avoid using like the word fail, but that's what happened. You did not pass or you failed. There's only so many words that you can use to describe that, and trying to talk around it is very obvious. There's no point in trying to talk around it, especially because the program directors, they have your USMLE transcripts. They know if you have received a low score or if you have multiple attempts. So take responsibility, address it head on, very, very straightforwardly, and then switch gears immediately into either why it happened, and then what you learned from the experience, what you did to fix the issue so that you did then, score higher on step 2, or that you passed on the next attempt, whatever the case may be. A quick word about that middle part, addressing the why. So whatever your red flag is, there's a reason that it happened. And that reason could range from, I wasn't prepared enough, to, I lost my partner in a very horrific accident and I was distracted and I shouldn't have taken the test. So we have a range from like, kind of very legitimate reasons to it just happened reasons. If it just happened, don't try to make it sound like it's a bigger thing than it is. It just happened and you take responsibility, and then don't spend sentences and sentences trying to explain the why. Just move into the positive aftermath and how you adjusted to account for the red flag.
Yeah, and so some examples that people have questions about would be, the first I want to address is a gap in medical school education. And what's important to understand is that there is a very specific question in the ARIS application asking if you have a gap in medical school education. And you can address that in that section of the application, and you don't need to repeat it in the personal statement unless there's extenuating circumstances that you feel needs addressed in further detail. But in all honesty, that question can be answered almost entirely in the ARIS application. And you don't want to pound it into the reviewer's mind in the ARIS application and in the personal statement if it's not necessary. You know, if you took a year or two off for various reasons, studying for exams, financial hardship, talk about it in the ARIS application, and then focus on why you're a great candidate in the personal statement. Another aspect of the medical school experiences. So, you know, I see some questions coming in about, you know, if you failed a class in the first semester, you know, many applicants have some hiccup in their medical school training. And it's not necessary to dive into that in your personal statements. They're going to see that in your medical school transcript. If you had maybe an issue in one of your rotations, they're probably going to see a little note in your MSPE. And if it doesn't need more explanation, don't give it more attention. And it's very important to understand when you want to draw attention to something and when you don't. So a failed attempt on the USMLE is typically something that a good majority of reviewers might want addressed in a personal statement. A low score is not necessarily something that every candidate needs to address. You know, I see a question coming in about a 224 on step 1. And that's below the national average. It might be below the average for the specialty you're applying to. But just outright talking about that for the sake of talking about it because you're insecure about that score is not necessarily going to help you. Now, if you're applying for an extremely competitive specialty, then talking about that lower score may be helpful, especially if there's evidence for the fact that you were able to, you know, increase your steps 2 score by 30 points. Really making sure that the overall content is extremely constructive and positive in nature. But just talking about a low score to talk about it may come off as more of an insecurity than actually a red flag. And talking about your year since graduation, it's another example where instead of talking about the fact that you've had a longer time since graduation, talk about all the amazing things you've been doing since graduation. You know, they're going to be in your CV, but really, again, focus on the growth. Focus on creating a narrative of your trajectory to becoming a physician and becoming ready for residency. That's, to me, what makes another strong statement. It's, I feel like I got to know the person and I got to know their story. You know, what was their actual path to get them to where they are right now? And if that's something engaging and relevant, then I'm going to be more interested in inviting that person to an interview and talking about, you know, these great things they've been doing in the past 3, 5, or 10 years since they graduated medical school. But again, don't say, you know, I know it's been a long time since I graduated medical school, but, you know, because that comes off as insecurity, it comes off as highlighting the negative, whereas you could be focusing on the positive.
Yeah, I mean, and a lot of it is just in the phrasing. So like Zeph said, saying, you know, I know it's been a long time since I graduated. However, instead say my decision to delay residency turned out to be, you know, quite amazing because I had X, Y, and Z experiences that have now left me very extraordinarily prepared to jump into residency with a skill set that is different than most of my peers. So, you know, it is all about your phrasing and how you choose to talk about things. And it's important, as Zeph said, to do it really positively and to point to your reader's direction and attention to the positive aspects. Another thing to consider too, when it comes to the lower scores, as you were mentioning, one thing as the writer of your personal statement that you have to think of is that your reader has already seen your USMLE scores. You're not going to be shocking them when they read the personal statement like, oh gosh, I had no idea that this applicant had a low score. So they've seen your score and they decided, I still like this application. Like maybe that's not the best score, but I really like this set of experiences. I really am impressed by this letter of recommendation. I'm going to read the personal statement to learn more about this person. No program directors are going into a personal statement like, I'm going to read the personal statement and I hope the whole thing is about why they got a low score. So that's just not going to be the case. And it's important to think about that when you're composing that statement. Just remember, they've seen your score, they still want to know more about you. So you don't have to convince them at that point.
Exactly. Ready to dive into some of the questions that we're getting through the chat here?
Sure. Let's go ahead
Perfect.
and do that.
So I've actually reviewed some of them, and I think we addressed many of them already.
Okay.
And so I'm just going to kind of go through some of the ones that I don't think we've addressed as thoroughly yet. So the first one is 850 words okay?
So technically speaking, you have a pretty wide berth of how many words is okay. I think the actual ARIS application will allow you to submit almost 3 pages for your personal statement.
Right.
You don't want to do that. 850 words is on the longer side. Is it too long no matter what? Like you absolutely shouldn't? I would say no, but I would say it's highly likely that you can trim down to get it to at least 800 words. That can be difficult, but that's where like an editing service can really help out. Professional writers are trained to know how to trim the excess fat from something that might be a little bit wordy. So, 850 is okay. I would really strive to get it down to 800.
Mm-hmm. Exactly. Can I address U.S. visa denial that caused a gap due to my country being blacklisted? Or is it political?
Oh gosh, you can address something like that, but you do want to be very careful how you're addressing it. Your personal statement is not the place to get into political beliefs or any type of discussion that's going to stray too far away again from you as the applicant. So if you do want to explain that further than the space that's allowed in the ARIS CV, if you have that gap, you can address it, but you should do so briefly and very neutrally. Just presenting a factual explanation, not really, diving into the details of the political reasons.
Right. And again, like Tiffany mentioned, if there's a gap in your medical school education, talk about it in your ARIS application and leave it at that. My visa was denied and I wasn't able to continue my clinical rotations. Instead, I did this, 3 sentences, 4 sentences. That's all you need to really make sure that that question gets addressed appropriately.
Yeah.
All right. So personalizing, what are your thoughts on personalizing the statements to specific hospitals or regions?
So if you have got hospitals, specific programs or regions that you are very, very interested in, like there is a very strong reason that you almost need to match, then that's okay to go ahead and do it. But you have to be convincing about it. Just dropping in a different program or hospital's name, in a place or two in a personal statement, it's very obvious that that's what you've done. So the only time that you should be that specific is if you've got, like I said, a very strong and compelling reason to want to attend that particular program. And that might have to do with like a research study that they're involved in or a particular attending who you've been following their research and you really want to train underneath that person. And then that would actually take up a chunk, a small paragraph of your personal statement. So you can customize your statements for specific programs, but don't do so just to throw the name in.
Right. Yeah. I mean, if you're just going to insert a program name, you probably did not do enough. And that actually comes off as very disingenuous, because if a program feels like you literally put the exact same personal statement and just put their name in there, it makes you look disingenuous. And so like Tiffany said, you need to be dedicating multiple sentences, maybe a short paragraph to that specific program. And it is absolutely 100% okay to tailor as many versions of your personal statement as would be beneficial to you. So if you want 20 different personal statements for your top 20 programs, and then an extra 2 personal statements for specific regions that you're interested in, that's okay. You know, the more tailored your personal statement can be to get you to the type or region of a program that you're interested in, the better. You know, let's say you grew up in Texas and you're really only planning on applying in the Southwest. Talk about it. You know, why are you interested in this region? You have family ties, and all the programs that you apply to in the Southwest should get that personal statement and that explanation. Obviously, if you're applying to a program in Maine, don't have that same version of the personal statement. And an additional point I'd like to make is that some programs actually expect specific questions to be addressed in the personal statement. And so that's something to be aware of. And if you know that they have that requirement, make sure you do address those in the statement for those programs. And then this is a follow-up. Should we have separate statements for community versus academic programs?
So that's really along the same lines as the last question, and the answer is similar. You most certainly can. So let's rewind for a second. You know, your personal statement, the focus is on you. The focus isn't necessarily on the type of program that you want to join, unless that is really intertwined together. So if you want to be in an academic program and there are items on your CV that demonstrate that you've been working toward a placement in an academic program, then you can highlight that. Definitely. You want to make sure, of course, that community programs aren't getting that particular personal statement, that it's only the academic programs getting it. So I think Zeph's advice about having as many versions of your personal statement tailored to the different programs, be it for a geographical region or a specific type of program, that's wonderful. It can be brilliant. It takes time. So that's something that you really have to consider. You need to do a really good job tailoring each personal statement for a specific program or region or type of program. So can you do it? Absolutely. It needs to be done really, really well in order to be convincing. So keep that in mind.
Mm-hmm. Yeah, and if people have any last minute questions, make sure to leave them in the comments. Let us know how your personal statement's going. If you are looking for professional assistance with editing, refining, polishing, and optimizing all your application written sections, like your ARIS application and personal statements, the supplemental application, definitely go to residencyexperts.com. That's where we provide the editing and optimization services. Turnarounds are just 1 to 2 or 3 business days for most of our solution packages. So they're expedited and you can get your content perfected extremely quickly. And if you need help writing your personal statement from scratch, go to residencystatement.com. We have a comprehensive questionnaire as well as an incredible team of professional medical writers who is truly invested in helping you have the strongest statement possible. So Residency Statements is where we have the writing services, and definitely make sure that you are getting the help you need, because I was just having a conversation with Dr. Carmody regarding the supplemental ARIS application. And I asked, when you're reviewing an application, what is one of the most important flags that comes up? And his first answer was English proficiency. And if you do not seem comfortable with the English language, your spelling, your grammar, construction is off, they're going to assume you do not have a strong grasp of English or a strong enough grasp to do well in the program. And that may not be the case. And you need to make sure you're doing what it takes to ensure your materials are written to perfection, essentially, because you don't want to be sorted out because you didn't know how to spell certain words or your sentence construction is slightly off compared to a native English speaker.
Right.
So definitely get the help you need.
Great advice and great tips.
Yeah, so I think we got a couple more questions coming in that we can try to address. Okay. We have one question that came in a little bit late. Is it okay for the PS to be structured like a story? Watch from the beginning of the live and we talk a lot about the structure. It should not, the full thing should not be a story. And then I think we had one more question. Without the fear of being judged as emotional dramatic. Okay, so that's a good qualifier, and I hope you don't mind if I address this one a little bit more, but
Sure.
you don't want the full statements to come off as one long story. It's not a creative writing piece. It's okay to have a narrative of your trajectory. It's okay to highlight your path so that people have a firm understanding of what your experiences have been like from starting medical school to right now. So it shouldn't be written like a story, but it's okay to have elements of, you know, chronological order. You know, first I was in medical school and this happened. Afterwards, I had these experiences and they impacted me in these ways. I learned X, Y, and Z, and now this is my expectations of residency and my future vision and goals. You know, that's a chronological sequencing of events, which helps people understand the content better. Do you have anything to add to that, Tiffany?
I agree with everything that you said. I think that, you know, the organizational approach, it can definitely be chronological. And I would say it even most commonly is a chronological approach. That doesn't mean that it has to be, but sometimes it makes more sense to start with an experience that you had after medical school and then kind of rewind and go back to the beginning of medical school. So it really is a unique approach for depending on the particular content that you're sharing. For most people, though, a chronological approach is going to work best. And as you said about the story, this is not a creative fiction piece of writing. It's professional document, much like a cover letter. So it needs to stay within its own genre. Yeah.
Mm-hmm. Another question came in: how to develop the paragraph dedicated for expectations for residency programs?
Can you repeat that one?
How do you develop the paragraph dedicated for expectations for residency programs?
Okay, so, well, first of all, I would say that you should I'm a big fan of the bullet point list. So do some, what I would call free writing. Make that list of what are your expectations? What do you really want in a residency program outside of what you're going to get, whether you like it or not? You're going to get clinical experience. You're going to be working with patients. You're going to be learning from attendings. All of these things are going to happen. So outside of those, get that list going, brainstorm what it really matters to you. And don't just think about, you know, what you think the program directors want to hear. Think about what is genuinely important to you, both in the first several months, in the first year, and then going forward. No matter, you know, maybe you're going to be in a 4-year program, maybe it's a 7-year program. Think about the big picture, and doing some brainstorming, gathering those ideas should give you enough to work with where you can put together 3 to 4 sentences that captures the essence of what you're hoping to experience.
Mm-hmm. Yeah, and that's another point I'd like to make, which is you don't need a full paragraph dedicated to your expectations for residency programs. You know, typically I would say it's between 2 to 3 sentences. And then, you know, you don't necessarily need to write a whole 8-sentence paragraph about your expectations for a residency program. It's something that ties nicely, again, into the conclusion. It leads into your vision and goals. And something else to consider is, what is the culture of the residency program? Not just the training itself, but what is the environment that you'd like to be a part of? And it can help, again, create signals for residency programs that, oh, this person would fit into our training culture. Not just the program. Again, they're not looking for automatons and robots. They're looking for human beings. And the personal statement is a great place to express aspects of your personality. And it's okay to do that. You know, people have a fear of being emotional or overly dramatic, and those are very real concerns. But don't be afraid to show some of your personality and to really make it so that programs have a better feel for who you are as a person. And that's something I always ask myself, you know, if I'm reviewing a statement that we've worked on and I am critiquing it. Do I get a sense of who this person is, or do I not? And if I have, you know, if this could be one of 100,000 people, then your statement is going to be very generic. But if I read that statement and I say, wow, I feel connected to this person in some way, like I have truly learned about their humanity, their struggles, their strengths, and I feel confident in working with this person, then you've done it right. Yeah.
Yeah, and I would add to that too that a lot of people I think feel a lot of pressure to include every last thing in your personal statement, but there's a lot to be said for the common phrase, leave a little to the imagination. Make your program director reader curious about something. You want to leave something for the interview. You want them to want to learn more, right? So they're reading this personal statement already to learn more. And if they feel that now they've got it all, like they kind of know everything that there is to know, then they're not intrigued in the way that you want them to be. So you want to leave a program director with the mindset that it would be really interesting to interview this person. So that speaks to what Zeph said about really having a lot of tone and your own personality within the personal statement, and then, leaving the program director excited about you.
So I see we have another question, and it says, I pivoted from journalism into medicine. Is it okay to use that story in the personal statement, or have to find one specifically coined for the specialty? And my answer to that is, it's absolutely okay to talk about why you changed from journalism to medicine in the personal statement, because a program is going to look at your CV and say, why did you do this? And so the personal statement is a great place to talk about that, to really give context for that change. And perhaps there's a merge, an intertwining of those two areas of your life that can be even further developed in the personal statement. Is there something you also would like to add to that, Tiffany?
Yeah, I think that a lot of people think that if there was any trajectory in their life other than medicine, that can be a distance when it comes to. I'm not sure that that's the case. I think that for those applicants that have a previous career, or some, if they took a side job that they had when they were a medical student and had an entrepreneurial spirit and kind of grew things a little bit more, and now they're running, this online business on the side or something, that actually can be favorable to you because it's going to help program directors remember you. Like, yeah, I remember the personal statement from the journalist turned doctor. Like, that was interesting. I want to talk to that person. So if you have, an atypical background and then just go straight through all the way to residency, highlight it as a positive. Definitely address it in your personal statement in an interesting way that is going to make your reader think about you after they're done reading.
Yes, 100%. So I believe we got through the majority. Oh, no, there's some more. Okay. Should I address not matching? Oh, this is actually a great question. Should I address not matching last year? And the rest of the question is, if yes, mentioning COVID sounds like an excuse. So is it okay, is it advisable to talk about not matching in the personal statement?
I think that that's a very difficult question to answer, and it depends on the reasons why you didn't match and what did you do during the year off, right? You weren't really off, but what did you do during that year? Maybe I'll defer to you first to see what your thought is.
Yeah, so in this case, my typical response is that you should not address not matching. The reason is it's not important. The important thing is, what have you been doing? And not matching is, again, an unnecessary negative, and it's an insecurity. And it's not one that directly affects your ability to perform as a physician. So focus more so, just talk about what you've been doing over the past year, or maybe include a few sentences about how COVID impacted your trajectory to some degree, but you were able to keep busy doing these things, and this is what you learned, and you're able to apply it in certain ways in the future. But just addressing not matching typically is not necessary. If you didn't match and then you had a gap of clinical experience and you need to address that gap, that's the important thing to talk about. But typically not matching is something that it's better left unsaid, to be honest. Focus on true red flags in your candidacy and focus on the constructive aspects of who you are as a person and as a physician.
I'm glad that this question got asked because it brought up another question about how much should you talk about COVID in your personal statement? And the answer is not very much. Everybody knows that COVID has impacted aspiring physicians' journeys toward residency. It without a doubt has made it more difficult for people to get clinical experience, and we've seen all of these the tele-rotations and virtual rotations that have emerged from the COVID pandemic, and it's just not necessary to go on and on about it. Now, if you want to talk about COVID in the capacity that you gain some clinical experience working with COVID patients or helping with COVID outreach or something like that, that's great, that's different. But talking about COVID as a reason why you were unable to do something or a reason why something happened, really minimize that and avoid it if possible. Again, because it's not new information and it has affected everybody. It's definitely not a unique thing for any one person to write about.
All right, I think we're going to wrap it up with one last question here, and it's actually a pretty interesting one. So is it okay to hide the date of birth on the heiress CV for an older applicant like me? And basically what we typically tell applicants is that be as honest as possible. If you hide information, programs are going to want to know why you did that. And it's better typically to be forthright in everything that you're presenting to programs. Whether you had a misdemeanor in undergraduate of college or you're an older graduate, be as straightforward as possible. Programs don't want to get the sense that you're hiding things. And it's really up to you whether or not you want to hide that information or not. But typically, I think the best strategy for most people is to be as forthcoming about their status as possible. And we just spent the last hour plus talking about how to present things in best light as possible. So if everybody out there does have questions or they want that professional help to make sure their heiress application and personal statements are appropriate and they're professional, definitely go to residencyexperts.com. That's where we provide the editing. If you need help with writing your personal statement from scratch, go to residencystatement.com and we'll be able to help assist everybody there. If you have more questions about any of the topics that we've discussed, feel free to reach out to any of our support channels through Match a Resident, Residency Experts, Residency Statements. We're definitely here to help. And it's been a really fantastic conversation. We've talked about a lot of the ins and outs of the personal statement, and I hope that we were able to address everybody's questions. Tiffany, any final parting words for us?
Just a reminder that, again, if you haven't started, you need to start now. Don't delay anymore. You've only got 2 weeks left, and it's important not to rush it if you want it to be good quality.
Wonderful. Well, thank you so much, everybody. And make sure you stay on top of all of the to-dos. Again, remember that the supplemental heiress application is going to be, the first due date is September 19th. It's coming up in 5 days. If you need help editing the supplemental application, go to residencyexperts.com. Get it submitted before the 19th so that it's available to programs on the 29th. Remember that applications go out on the 29th. It's not October 21st this year. It's not tomorrow, luckily. September 29th is the big day, and we'll definitely be in touch. And thank you all so much. We'll talk to everybody soon.
Thanks, Seth. Bye.
Bye-bye.